2023 Circle meeting. My name is Angela Fields, and I'm the newly appointed Associate Executive Director of the Minnesota CHW Alliance. Today I will be walking you through our meeting topic, which is the Minnesota Community Health Worker Alliance, commonly called MNCHWA. And our topic overview is coming together and joining our organization and meeting the staff, learning about the exciting things that are happening with the Alliance, as well as across the Minnesota CHW landscape, including we're going to touch base on some of the components of the governor's 23 to 25 binary budget. And so I myself is one of your guests. Mao Zhang is with us as our registry coordinator. We also have Ann Gainey as our project manager. We have a host of other individuals that are joining us today from various committees. And so we're just going to roll out the Alliance. So I have a short PowerPoint. We each have our own separate PowerPoints, and we're just kind of give you an overview of our perspectives or our area of work that we do at the Alliance. And today we will cover in our presentation the Alliance overview. So we'll talk about the staff and other members, internal or external. We'll also touch a bit about the CHW field building in Minnesota, the successes and some of the challenges. We'll talk about advancing CHW integration and health equity and how you can get involved. And then we will open up the floor for questions and discussion session. As we're going through the presentation, if everyone can mute your mic, it would allow for a more clearer, smoother, crisper audio recording for us. We won't get any of the back view noises and various things like that. And by all means, protect yourself and your level of privacy. So if you select and I have your camera on, please feel free. I'm really interactive, so you can use the emoji to express yourself, or if you want us to raise attention or just drop something in the chat, Mao and myself will kind of bounce off one another to man the chat. Mao is our registry coordinator, but she also provides a lot of the technical support for myself and the other staff here at the Alliance. So without further ado, we'll get going. So we're going to talk to you today about the mission of the Alliance. The vision is to create an equitable, optimal health outcomes for all communities. Our mission is to build community and system capacity for better health through the integration of CHW strategies. The Alliance is a nonprofit, is a statewide nonprofit focused on health equity. It's a health equity organization that focuses on CHW strategies and other innovative models. And the purpose, overarching purpose, is health equity. Our focus is to increase awareness of CHW roles and best practices in advancing health equity. And currently now is the quadruple aim. So they factor in the healthcare providers. And so also the healthcare workforce, to keep the healthcare workforce diversified. We provide leadership and build capacity for the comprehensive adoption of CHW strategies in the healthcare, public health, and social service settings to reduce health disparities. Our strengthen and broaden access to statewide competency-based CHW training, continuing education, interpersonal professional education, and resources. We expand the reach and positive impact of CHW strategies through public and institutional policy change. And we grow statewide partnerships as well as exchange field building info with other states and advance work at a national level.
Angela?
Yes.
There is a question that's asking, can you please clarify what the quadruple aim is?
The triple aim effect is the lowering health care costs, patient satisfaction. And so it's also factoring in the overall cost that is reducing for the utilization of a CHW on the health and social systems. But the quadruple aim effect is the quadruple aim factors in the provider or clinician's well-being. So since COVID really showed how the health crisis can exacerbate public systems and health systems, and how individuals that work in those entities, their health and well-being can be compromised. But if you invest in those individuals to help provide them the tools and mechanisms and the support and funding that they need, overall improving the well-being of those providers will also improve the well-being of your audience base, as well as it will save costs across systems. So that's just kind of a summarization of it. And we can table the questions until towards the end, and our staff and I will come together and answer those questions. What does the Alliance actually do? There's an advocacy component that we engage in. We provide education to the community. We have our Community Health Worker CHW registry. We have partnerships with other organizations throughout the state and beyond. We have leadership development training for CHWs, as well as supervisors of CHWs. And we also provide consulting services. Our connecting links are CHWs. So CHWs, as we know, are a profession that identifies and bridges gaps between health and social systems and the community. And so they are in these roles. Oh, I'm sorry. There we go. These trusting relationships that community health workers establishes with their community, they act as liaisons, intermediaries between health and social systems and the community to facilitate access to service and improve quality of care in a culturally competent service delivery model. I will stop this. I was at this point of the presentation, Ann Gainey, our program director, will give you a bit of historical facts about Mentua. Ann, would you like me to?
It always helps to unmute. So, hi everybody, thanks. So, the historical facts about Mentua is it's been around since the early 2000s. It started out working on a curriculum, first looking at a needs assessment of what would help the CHW field grow. And when we asked CHWs, they wanted a credential and a way into higher education. When we asked employers, they wanted standardized training and a credential. So there was a lot of overlap between what CHWs and employers and even health plans wanted. So that brought about the planning and work on the CHW certificate curriculum. So that was done in the early 2000s. It was piloted in 2005 and really implemented after that. So it's been around that long, almost getting close to 20 years. The curriculum itself was based on a scope of practice and implemented into community colleges. It's now in 3 community colleges in Minnesota and also St. Catherine's and St. Mary's, 4 community colleges, Midwest, Normandale, Rochester, and Northwest Tech. And from there, so the big things were early on, the curriculum, the scope of practice, and the legislation that allowed for reimbursement. And from there, the Alliance grew into a small nonprofit and has remained a small nonprofit to build with a health equity nonprofit to build the field in CHW strategies. We implemented a CHW leadership program in about 2016, and I think about 80 CHWs have been through that across the state now. And it's an exciting time to be in the field now because there's lots of changes, and we're going to talk more about those as we go through the presentation today. So yes, I like Latrice's fireworks. They're good changes. So I think I will stop there with historical facts.
Thank you for the historical facts. And so I would like to introduce you to our staff. Our board of directors oversees and supports the organization's strategies. So they're our advisors. Then we have our executive director, which right now, Adri Lobitz was our prior executive director, and she has transitioned out of her role. And so we are seeking a new executive director. And in this role, the leadership, and it guides the leadership and the organizational direction. And then we have the associate executive director's role, which is the role that I am in now. And it is in the operations and in community engagement. And I'll read you kind of an overview of my position. It's the first of its kind at Mintua. It was implemented in fall of 2022, so it was literally just created. It's sort of a fluid role right now because we're building it out. And the role is responsible to supervise the daily operations of the organization as directed by the executive director in ordinance with the policies and procedures established by the board of directors. The associate ED position is also responsible to serve as a community engagement manager, leading and coordinating community engagement efforts, communicating with internal and external stakeholders and partners of the Alliance. The position reports directly to executive director, but currently I report to the board chair. My duties and tasks include I work closely with the executive director to ensure day-to-day operations of the Alliance are functioning effectively and consistently with the organization's purpose, policies, project goals, and timelines. Provide leadership and manage the efforts of the Alliance's contracts to ensure appropriate support in completion of these projects, contracts, and the continuing growth of the Alliance, as well as the community health worker strategies with the executive directors. I assist the executive directors in supporting the board of directors. I attend community meetings and assist with projects or incentives of those committees. I serve as the Alliance Community Engagement Manager. And so I hold the responsibility for developing and implementing a strategic relationship management plan to ensure regular communication with stakeholders that will ultimately advance the Alliance's mission and lead to sustainability for the organization. I contribute and assist with organizational contracts, grants, or projects as needed or as assigned. I assist in monitoring project status reports to ensure projects stay on track, and other duties as assigned or consulted to fulfill as assistant with the Alliance in programming growth. So that's pretty much what I do in my role. And so Anne, myself, and Mal work very closely together. We're considered the only contractable staff of the Alliance. Anne is our program manager, director. She wears many hats, so it's oftentimes blended for me. So one day I might say program manager, program director, and such. She's an advisor to myself as well, and Mal. She has a lot of wisdom, and she's been with the Alliance and loves the Alliance. So she's always our go-to person. And we have Mal Zong, which is our registry coordinator. Also, you may have, if you have the newsletter, Mal does all of our communications on behalf of mostly all of our communications on behalf of the Alliance, so our newsletters, our blogs, our YouTube uploads. She does all of the uploads from our recordings, from our meetings and various things like that. So she's a one woman wonder. She does all of our technical training and our advising and various things like that. So that's how we kind of work with each other. And some of our jobs work alongside of each other. Some of our tasks overlap with one another. So we're always try to make ourselves readily available for one another and be able to jump in and help as a team, because we are such a small unit. What do we do? I kind of covered what did I do, and I explained my role and responsibilities. I'll turn it over to Ann Gainey, and she can kind of give you a overview of what she does and the title that she prefers to go by. And then we'll then have Mal.
Always forget that. A little bit earlier, you saw a sign with a lot of circles on it, a slide with a lot of circles that said many of the things we do. We do a lot of communication and education and advocacy to further and grow the CHW role. We do project specific work. We write grants to get projects, and then we do the work on those projects. We're going to tell you a little bit later about our HRSA grant that will be coming up. And we have our leadership program, which builds leadership capacity in CHWs. And then we just do a lot of work to help with the schools that have the curriculum, helping them keep it standardized. The schools do a fantastic job. We just have monthly meetings to keep that curriculum standardized and share information. It's really a unique model within the Min-State system. And then we do the CHW circle. We do a supervisor roundtable in which supervisors, people who supervise CHWs, get together to learn together and to problem solve. And Rachel Stoll is here today. She facilitates that, the supervisor roundtable. So to put it in a really short form, we do a lot of project work that's grant funded. We do a lot so our work is grant funded. There's a lot more work that we could do, and there are a lot of demands on the Alliance, but we do what we are funded to do. And we are always looking to grow that as well. So I will stop there.
Angela, you're muted.
Oh, I was calling you up. I was like, could you share?
Oh,
your
okay.
role and what you do?
Yeah, definitely. If you could stop sharing, and then I can share my slide.
Sure.
Okay. Let me see here. Okay, everyone, thank you for coming onto our brief short presentation here. I am Mao Zhang, and I am a CHW. I'm also the registry coordinator for the Alliance here. And I will go ahead and start my presentation. So what is the registry? And with the registry, we connect with other CHWs around the state to learn from each other. There's information about the CHW Alliance, how we came to be. There are also information about who are CHWs, the health equity information on the website as well, CHW resources, newsletter, and blog that you can register for, and get updates every month. There's also a tab where you can register and donate to the Alliance as well. There's also learning opportunities such as the circle and other educational events from other partners and organizations that we partner with. And then we also have job opportunities that we post up either through the Alliance or from other organizations as well. So for the registry, it's all online. And then our purpose, the registry has a multi-level purpose, and it is a professional development tool for all CHWs. It is a connection and recruitment point for stakeholders or other community members, and a way to define and evaluate the CHW field. And this is kind of like what it replaces their certification with. And this is kind of like a little overview of what the registry online would look like if you are not logged in. So again, if you would like to learn more about how this CHW Alliance came to be, you can click on the About button, or there are other information such as like who are CHWs, more drop-down boxes will go from there, health equity, CHW employer resources is coming soon, so please be on the lookout for that. Other CHW resources, again, newsletter and blog. The Minnesota CHW registry, this is where you would click to register as a CHW or stakeholder or other community members. And then you can also donate to the Alliance. And then this would be your login button. But once you log in, your front page would look like this, and it'll just have the My Profile on there. And the My Profile would have a drop down for like job opportunities that's available to the CHWs that I update on, and then as well as other educational free sessions that you can join. That's always updated weekly. And then over here on this side over here, there's news that we update that's really big. So the last one we have updated was about welcoming Angela Fields as the new Associate Executive Director. And then my role as the registry coordinator, Angela kind of talked about it already, but I do a lot of technical support for CHWs, such as, you know, getting you receipts of what you paid already to join the registry, or if you can't log into your account, I would be the person to help you with that. I also update our social media, the registry, which is online job posting and education opportunities. I co-host educational events such as the Circle Here and any other project support that is requested of me by either Ann or Angela. So I do a lot of more of the technical support. And then if there's any questions, you can ask them at the end. And I want to say thank you. Okay, give me a second here. You can go ahead and share your screen again.
All right, thank you, Mel. All righty. So what we're gonna lead up to is the work we do is oftentimes more or less grant based, and so we also have oftentimes some other avenues for potential funding. And so I'm gonna kind of precursor and start leading us into talking about supporting CHWs through the Governor Walz's budget proposal. It has allotted funding for the CHW workforce development and evaluation. The Alliance will be the Minnesota Department of Health's partner in this work. And Ann will talk in great deals about that, in as well as the other grant opportunities that the Alliance is also in proposal for later in the presentation. And so it would supporting the CHW development. And so the governor recommends expanding, strengthening, and equipping and evaluating the CHW health workforce in Minnesota. And so these fundings that are in the budget is to support the health and well-being of Minnesota by partnering with the CHW Alliance to promote the profession and the scope of practice for CHWs, but also to conduct program evaluations, like to really show the validity and value of a CHW, and as well as to provide as needed technical assistance for the Alliance to grow. Specific activities include an awareness campaign, also partnerships with employers, research and evaluation of the CHW model, and the statewide infrastructure plan. So really thinking how to really strategically invest in the CHW profession to help our profession grow and develop and get the full notoriety and support in the systems as we're seeking. And so that's and so how we do these things is how we can help as an organization. We can start talking about CHWs. We can start spreading the word about, how advocacy works. And so if you advocate on behalf of CHWs and you reach out to your representatives or you write letters of support for the Alliance, to these representatives, that keep us on the forefront. And it also it's when it allows to provide testimonies in regarding to your experience as a CHW or others' experience as a CHW in the field, as well as on the behalf of the Alliance as that intermediary there for the representing the profession. And so, so there's an organizational piece that can be done, and as well as an individualized piece. And so I think I sent out in December or November. My timeline is kind of blurred because it's a lot of work that I've been doing, but there was a call to action, and there were template letters that you could just fill in your information and some points or advocacy areas that you would like to have bring to the attention of your representative, as well as links where you could be able to get in contact with your representative, as well as research your representatives and figure out where their passion lies, what are their issues, what is their focus, and various things like that. I learned quite a bit about that just recently, of how our voices can still be heard on an individual base as well as an organizational base. And we could talk further about that a little bit later into the presentation. So if you're interested in becoming involved with the Minnesota CHW Alliance, feel free to visit our website. There's tons and tons and tons of information there. As Mal walked us through, a lot of the drop down boxes about us, our focus, our mission, our guiding principles. There's a lot of archive news and various type of information there. It's all of the updates that's going on and various health topics, and there's some light-hearted things there too, based on holidays and various things like that. One of the things that we have too is you can sign up for our newsletter on our website, and that's also keeps us on the current events of what's going on with the Alliance and across the state, as well as we welcome anyone that would like to be spotlighted in the newsletter, or if you have a colleague or if you're a supervisor here with us today and you just have an outstanding CHW on your team, please bring that to our attention. We were just rolling out, we have one of our CHWs in the rural community won the MLK humanitarian award. And so that was released and posted in the newsletter. And so those type of things, we want to highlight CHWs and the great work that we do and the vast types of work that we are involved in. Also, there's links on our website to our CHW registry. And so that's, to me, it's comparative to almost like a LinkedIn kind of site. And so therefore you can connect. There's a message board. You can communicate with one another. You could enter your credentials. You can search for job postings. You could search for training options and various things like that. So it's just another platform for CHWs. Also, there's a lot of updates and various things like that that Mal includes in there, and as well as our committee information is there. And so also with the Alliance, we provide the supervisor roundtable meetings. So those are quarterly meetings where supervisors come together to learn, just as we do in the learning circle. So it's a circle it's a roundtable for supervisors. So they come and talk about strategies, resources, they troubleshoot, brainstorm, and figure out how to support us as CHWs, as well as contribute to the growth of the profession. And so we have our CHW Learning Circle, which is a peer level meeting that we know that occurs once a month. And so the circle is a monthly capacity building event for CHWs. And so it's facilitated by CHWs. And in the circle, we learn with peers and we explore issues in our field. It also provides an environment where CHWs can share their successes or their concerns, or just gain a perspective of the CHW workforce and profession from their peers. And so in these multiple environments that we work, we're able to come together in the circle and learn together and learn about the different workforce settings. And so it's helpful for us to still connect, even though often the time our platform is not face to face, but we're still able to connect in some type of way. And we encourage you to join a committee. So we have our education committee, we have our legislation committee, we have it's like a per diem conference committee if we're in a conference planning committee. And then I'm still learning all the committees myself. So if I've omitted one, I totally apologize. And but Anne could she has a lot of the historical content, so she can fill in the blanks of anything that I left out. And to wrap up my portion of it, it's just been a pleasure to be here with you and share what we do at the Alliance. And I'm going to turn this portion over to Anne. So I'm going to stop sharing, and then she could fill you up on the current events of what's going on in the Alliance.
Yeah, thanks, Angela. I don't think you missed anything. I'm going to pull up a